Deputy DG of the Municipal CDC, Mr. Wu Huanyu. First of all, to Madam Wu. Friends of the media, good morning. On April the 11th, newly added confirmed cases in our city 994, locally transmitted, and 22,348 asymptomatic carriers. Among the newly added confirmed cases, 439 discovered in the quarantine population and 282 confirmed through risk population screening, and 273 were previously characterized as asymptomatic carriers. Among the newly added asymptomatic ones, 21,844 discovered in the quarantine population, 504 discovered through the risk population screening. As to the 994 confirmed cases newly added, 532 were male cases in Pudong New District, 493 in Huangpu, 117. Minhang has 68, Xuhui has 48, Baoshan has 47, Jiading has 43, Putuo District has 37, Yangpu has 30 cases, and Hongkou has 25, and Chaoning 25 cases. Songjiang has 21, and Jing'an has 20. Qingpu has 7. Chongming has 6. Fengxian has 4. And Jingshan has 3 cases. Combined with their epidemiological records, clinical symptoms, lab test results, and imaging results, the above-mentioned 994 cases are diagnosed as mild cases. We have 22,348 asymptomatic carriers with positive result of nucleic acid test. For more details, you can go to the website of Shanghai Release. As of 9 a.m. this morning, in total, we have screened close contacts of a number more than 252,000. All of them are put under control, among which 212,000 people have already a negative nucleic acid test result. For the rest, we are doing the test for the close contacts of the close contacts, 118,000 and more. All of them are put under control, among which 116,000 and more have already delivered a negative nucleic acid test, and for the rest, we are doing the continuous testing. For yesterday, the designated hospitals and makeshift hospitals have discharged and also removed people out of the medical observation of a number of more than 6,000. They will go back to their residences for the continuous follow-up observation and household. Since the 31st of March, we have already discharged and released more than 20,000 people out of medical observation. According to the work arrangement, and judging by the status quo of Shanghai, we have already divided the whole city into 3 zones. And according to different zones, we have the tiered management mechanism, considering that this huge number of positive confirmed cases, we still have to never lower our guard, and we should not relax ourselves. We have to try our best to encourage the household-based work, and we have to encourage people to avoid unnecessary going out of their household. If you have the need to go out of your house, please wear your mask correctly and also respect the social distancing rules. And today we're also witnessing a rather high level of the confirmed cases of COVID-19. We can see an ever-growing number of the elderly cases of confirmed COVID-19 results. And usually for the elderly persons, they are living with pre-existing conditions. Once there is the infection among them with the COVID-19 virus, there will be a higher level of risk for the complication. And we also urge the elderly persons to get themselves vaccinated. We will also show more love and care to this age group. So let's work together hand in hand and build up this great war against the COVID-19 and also have the network of collaboration in place. Thank you very much for your briefing, Madam Wu. Now the floor is open for your questions. Please ask the question after identifying yourself. Thank you. I'm with the International TV of CMG. Now we have the zoning policy, but there is still some flow of the people. So what's the policy for people living in a prevention and control zone? Thank you very much for this question. Since yesterday, Shanghai municipality has launched this policy of the zoning according to the result of the nucleic acid test. We have the zone-based management mechanisms. After this period of policy control, we have all this strong willingness to go out and fulfill our storage of food and medicine. We fully understand people's concerns and their wishes to go out. However, if there is a sudden increase of the massive gathering outside in an orderless way, then this will increase the risks for everyone. For the third level zones, the zone of prevention and control, it's not equivalent of the zero risk zone. And in this specific area, as is mentioned by our journalist, we still have to stick to the policy of community level management. We have to urge people to avoid unnecessary massive gathering. If you don't have an urgent need, please don't leave your household. If you want to take a break, you can just stay inside your residence or stay within your community. You should not go and visit the higher risk zones. For some areas neighboring the higher risk areas, the communities, they can also consider the strengthening of their policies of management. This is all for the purpose of consolidating our success of the controls. And for the prevention and control zones, every week we will run 2 rounds of the antigen test. They can also join voluntary nucleic acid test. For those people who do have a need for the outward visits, they have to follow the procedure. For everyone, they should shoulder their responsibility. And our hospitals should also collaborate one with another. We also encourage people to go online for the medical consultation, and then they can receive the drugs and medicines offline. For the positive cases, their residences as well as the community of origins will have this dynamic escalation of the management measures. We will never want to see the escalation and strengthening of the policy measures against any communities. So for everyone living in the city, you have to respect the rules and contribute your part to this fight against the COVID-19. Now we are applying this closed-off management. We are doing the mass screening on our population. Everyone living in the city has contributed to this fight against the COVID-19. I know that all of you have overcome a lot of difficulties and you have stomached a lot of inconveniences in your daily life. Surely everyone would like to go back to normal life as soon as possible. So together, just hold on for a bit more time. And I believe that finally the days of freedom can come back. Next question, please. Line number 22, please. Thank you. And with the first financial news, I've two questions for Madam Liu. For two zones of management, people cannot leave their house. How can we make sure that they have sufficient supplies for daily life? And sometimes we can still observe some obstacles in the delivery. What's the headache with today's logistics service? For the lockdown areas and quarantine areas, we have the packages of services, online supply chains, and also supermarkets. First of all, they assemble all the information about the purchases for people, and then we can deliver the packages of food and supplies to the people. For the lockdown areas, we have already put up the tips about the resolution of the last kilometer problem. For certain residences, we have designated some groups affiliated under the municipal authorities to do the delivery work. At the same time, we're also collaborating with a third party of delivery services to increase our capacity of delivery to people's doorstep. For the elderly population, infants, pregnant women, and also the other special groups, we have set up the special work teams, and we are collaborating with Meituan and Ele.me, those online delivery platforms. We are also open to the calls of people for emergency alert, and at the same time we are working with the other platforms of food delivery. We're increasing this capacity for the delivery of daily necessities to people's doorsteps. But still, some of the deliverymen, they cannot join this platform due to the considerations for COVID-19 prevention and control. So we have decided to bring more borrowed delivery forces into our region. We will do our best to rapidly transport more daily necessities from other provinces to Shanghai. We are also doing this combination of railway transportation plus vehicle transportation. We are also offering diversity in the packages of necessities. For example, we have different levels of prices for the packages. In these packages, you can find milk, instant food, milk powder, and also the daily food like the rice, the wheat, and also the eggs and other products. Line number 3, please. Thank you very much. I'm with the Shanghai Education Television. I have a question for Mr. Hu. For the buildings where we have discovered the positive cases of COVID-19, do you have any instructions for the disinfection? If we discover a positive case in the community, then there will be the risk of infectious transmission towards the environment. According to the work arrangement of the local authority, once with the discovery of a positive COVID-19 case, then for their trajectory and also their living environment, we have to take the prompt measures for the disinfection. With the disinfection, we can kill the virus in the living environment of this previously mentioned case, and we can also avoid further transmission towards the other actors. We have 3 aspects to guide the disinfection. First of all, for the household of this positive case, we propose that we have to carry out a prompt disinfection action in the environment where the positive case had already lived in. And for the dishes and also the bowls, we have to use a specialized detergent to do the disinfection. And for the other surfaces, we can wipe. And for the other areas and surfaces, for example, the floor, we can also use the special reagents to do the disinfection. You can also use the alcohol or the other disinfection chemicals to do that. For some of the citizens, if they have some concerns about the erosion effect of those detergents or the other reagents on the floor and on the other surfaces, after the disinfection, they can also use the clean water to wipe another time. And next point is about the disinfection of the corridor area. Once we discover the positive case, then inside the building, we have to clean the corridors and the other corners. For example, for those corners and also places that the positive cases have visited previously, for example, the buttons of the elevators and the handles and the doorknobs that the positive cases may have already touched, we have to disinfect all those areas. And for the public spaces inside the community and inside the residential parks, first of all, we will put the focus on the places that the positive cases have already visited, and later on for the other areas, we can also keep up with the other measures of disinfection. As to the road surfaces, wall surfaces, and the vegetation areas, it's not necessary for you to do a thorough disinfection for everywhere because we would like to avoid unnecessary damage to the whole living area inside the community. Next question, please. Line number 16. Thank you very much. I'm from the News Morning Post. Recently, in the supermarkets and the catering sector, will you gradually allow the restoration of the services? And what's the following up measures for the regulation? Considering the recent need of guarantee for people's daily life, we will gradually remove the lockdown measures on different spots of catering services and also supermarkets according to the demand of prevention and control. For the lockdown areas and controlled areas, we will first of all set up a whitelist for the convenience stores and supermarkets. For those spots and places not infected in the past, they have to first of all make an application towards the authority. For example, the local authority of commerce, and later on, with the approval, they can spread this whitelist to all the residences. And for the pharmacies as well as the other spots closely related to people's daily life, they could also be put under consideration. And for the other areas not closely correlated to people's daily life, and they are not considered as a must to people's daily life guarantee, we will postpone with their unlocking. For those business areas located inside the lockdown area and controlled area, every day we will run an antigen test and another round of nucleic acid test on their personnel. We also urge the personnel working in these business areas to take care of themselves. For the servicemen in these above-mentioned businesses, they have to live and work in a closed-loop manner. And for the ventilation as well as the disinfection, we also have to follow the procedures. For the businesses to restore their activities inside the prevention and control areas, they also have to apply the staggered policies and urge the personnel to wear their masks and also follow all the procedures. For citizens that go inside those places, they also have to scan their code. Last question for today. Line number 17, please. Thank you. I'm with the paper. I have a question for Mr. Wu from the Municipal CDC. Currently, people have mentioned they have worries to get the medicines for the mental diseases. How can you solve this problem for people? We have also noticed this issue. Currently, for people suffering from mental disorders, they can be characterized into two groups. One is the registered group, another is the non-registered group. For the registered ones, we have this mechanism of diagnosis and delivery of the medicine. So everyone is under our observation and they can receive our assistance. For the non-registered ones, they can ask for help by the connection of the community workers. In the controlled areas and lockdown areas, if people need the drugs and medicines for the mental disorder diseases, we can send the specialists and also doctors to treat them, and also we offer the online consultations. You know that in our country we have very strict regulation about the medicines related to the mental disorders and other diseases. So you have to first of all receive the prescription from the doctors. Today we have designated personnel to do the contact person. If you have the need, you just need to contact those persons of contact. And for those residences and street level committees with the patients in their area, the street office workers can also help to collect information to see if anyone has the need to receive more drugs to treat the mental disorders. You can also ask one volunteer to do this job for you. For example, the volunteer can help you to get the prescription and also help you with the delivery of the drugs. And that is all for the Q&A session. If you have more questions to ask, please just contact our information office. That is all for today's press conference. Thank you. You've done a great job.